Please go ahead.
Thank you, Dr. Garg, for the very kind introduction. I'd like to say hello to all the Rotary members. Thank you for having me here today. And Happy
Yes.
New Year to everyone. I'll start sharing my screen.
Yes.
All right. So, okay. Is it visible or the slides visible?
Yes.
Thank you. All right. So I'm going to be speaking on dry eye syndrome. Now, as a cornea and dry eye specialist, as Dr. Garg very correctly said, that past this lockdown and COVID, we've been getting so many patients with some or the other complaints of dry eye, and most of them don't even know they have it. So the aim of the talk is to just create kind of awareness for you all to understand what dry eye syndrome is and what are the real options available and how, as eye specialists, we can help you in this matter. So dry eye is definitely increasing. Pre-COVID, they said that 30% of the Indian population, especially our urban population, seemed to be having dry eye. And the figures predicted were that almost 50% of urban population, that is 1 out of every 2 people, would have some sort of symptoms about it. But the thing is that people are mostly not even aware when they have it. So how will any common person know if they have dry eyes? What are the presenting symptoms? So I would say these three, which you see right here, the sandy, gritty sensation, redness, or stinging and burning. Now, these are the most common symptoms of dry eye. These are accentuated if you are traveling in a car with your windows rolled down. And many people come to us saying that, I'm traveling and the wind was hurting my eye. Wind hurting your eye is one of the first symptoms of dry eye, which people are mostly not aware. It means there is something wrong with the tear film production in your eye, and you need to know about it. The other symptoms could be episodes of blurred vision. So some people have this in the morning. Some by evening feel that the vision is a little blurry than it was in the morning. And in most instances, this improves when you blink your eyes. So that's one of the other signs of dry eye. You can have some sort of discharge. You can have this thin strand coming out of your eye, or excessive tearing. Now you will wonder that if I have dryness, why do I have excessive tearing? This is in fact one of the main types of dry eye that people are not aware about, where you can have enough tears and yet feel dryness, which I'll speak about subsequently in my talk. And of course, fatigue at the end of the day. You can not have worked for many hours if you at any age, presenting from 20 to whenever. If you have been in front of your laptop, especially for long hours of time, you are going to have any of these symptoms. So we have also seen that dry eye sufferers are 3 to 4 times more likely to have trouble doing your mundane tasks, really your day-to-day tasks, like watching TV, working online, reading, driving, or doing any activities. So, what are the main causes of dry eye which people don't seem to be aware about? Everybody thinks that dryness means you don't have enough tears. Yes, this is one of the causes, where we have a gland just above the eye, above our eyeball, which produces the tears. So, in this main type of dry eye, we don't have enough tears to lubricate the eyeball, and as a result of that, you will feel the sandy, gritty sensation in your eye. But my main aim today is to educate you about the other kind of dry eye as well, which is the evaporative dry eye. Now, not many people are aware that we have tears coating our eyeball, and to keep these tears in place, we have a certain kind of oily secretion that comes out from glands above the eye. Now, if you will notice these red lines, we have glands in our eyelids which secrete a kind of oily which coats our tear film. Now, if there is some blockage or any other problem in these glands, what happens is they don't secrete enough oil, and as a result, our tears evaporate faster. So, you may have good tear production, you may even have watering, but you may still suffer from all of the symptoms that I mentioned above, only because these glands in your eye are not functioning. Now, who else may suffer from dry eyes? Well, anyone, especially the older population, if you've undergone cataract surgery, which is a very routine surgery. Long time contact lens wear, if you've been wearing contact lenses for many years or even a few years, but you wear it for say more than 8 hours a day, you are extremely prone to suffer from dryness in that case. Some patients after LASIK surgery or other forms of refractive surgery also suffer from dry eye, and patient on anti-glaucoma or other ocular medications as a minor side effects at times may also have some of the symptoms of dryness. Now, which health conditions predispose you? Not many may be aware that if you are a sufferer of diabetes, you may have dry eyes, because diabetes is extremely common, as we all know about it, but it also affects your tear production and the maintenance of tear film in your eye. So if you are a diabetic patient, if you have any of the symptoms that I mentioned, you are most likely suffering from dry eye. Apart from that, rheumatoid arthritis and many other forms of arthritis, also Parkinson's. Certain medications that you have for any other conditions. Some patients have urinary retention. Certain medications for blood pressure even can cause dry eye, and menopause. So dry eye is also largely a hormonal disease, and many menopausal women suffer from these symptoms suddenly. You may have been okay till then in life, but suddenly at this age, apart from all the other signs of menopause, you may suffer from dryness. So this is you can have dryness in any of these conditions. Apart from all the textbook factors that we've learned as ophthalmologists, there are many modern day factors contributing to dry eyes. Environmental pollution. We know we live in heavily populated cities where the air quality index is really pathetic at this moment. This has escalated dry eye to new levels. Practically every day there's someone calling with some or the other symptoms. Medications, as I previously mentioned, that you could be on medication for some other condition and that's causing dryness. Diet. uh, Modern day diets are not very compliant with general body health and health of our tear film and ocular surface, as well as mask associated dry eye. Now, this has been a very new occurrence, of course, which has come about with COVID. So, what is this? They say that when you're wearing a mask, and if your mask is not well fitted around the nose, the air that you breathe is going up and making our tears evaporate faster. So, of course, there's a way to reduce this. You can simply put a tape or buy a mask that's better fitting. But this has also caused a lot of increase in dryness and, of course, digital eye strain. With most people now having worked from home, long hours in front of the computer, digital eye strain is really an epidemic nowadays, along with our current pandemic that's hitting us. Though Dr. Deepak Garg will speak more in detail about it and how to combat it, it is one of the major factors which is causing dryness nowadays. So, if there are so many causes of one disease, of course, we cannot have one treatment. You cannot say that I will just put one teardrop and I'll be fine. Dry eyes definitely does not fit into the treatment spectrum of one size fits all. The treatment has to be customized. However, most people do have mild symptoms, and for that, you don't really need to rush to your ophthalmologist. So, I'll be giving you some tips on how you can manage mild symptoms of dryness at your end. So, the first is check your medications, speak to your doctor. You ask them if any of the medications you have could be leading to the dryness, could be aggravating it, and there will always be an alternative available. Improve nutrition. Of course, this is not just for your eyes, this is also for the general body health, but of course, eyes. Now, in cases of eye health and dryness, any foods containing omega-3 fatty acids or vitamin A. Some examples of that are dark green leafy vegetables, walnuts, and if you're a non vegetarian, of course, cold water fish. These are really useful for your eye health. Avoid pollution and irritants. Stay at home when you can. Wear protective goggles when outside. Keep your windows shut if there is construction work going on around your house. These are basic measures, really. Modify your diet to balance your hormones. In this measure, I'm talking about diabetics mainly. Have a low carb diet. uh, do what's best for your general health, and your eyes will consequently be healthy as a measure. Care with contact lenses. Now, this is mainly for the youth. I got a call the other day from someone who wears contact lenses 14 hours a day and now has developed dryness. They aren't meant for 14 hours a day. The contact lenses are supposed to be in your eyes for 6 to 8 hours at a stretch max. If you need to wear it beyond that, please take a break. Take a break and then re-wear the lens if you really have to. But again, only if you absolutely have to. Artificial teardrops. If you have mild symptoms, if they are occasional, if you get it, say, 1 hour a day, or if you get it once every few days, of course, you can use over the counter artificial tears. Though for long periods, I would not recommend them, because you need to visit your doctor to see which artificial tears are best suited for your eyes. And humidity, low humidity environment, again, can cause a lot of dryness. Hydrate well, hydrate yourself well. and blink. So one of the major causes of eye strain is also because people don't blink enough when they're in front of the computers. Our blink rate reduces significantly when you're in front of digital screens. So just blinking often, what happens is when you blink, that oil, which I explained in the lids above, coats your tears. So you will have lesser evaporation and better control over your dryness. Now, despite all these measures, if you don't feel well, you need to visit a dry eye clinic. Why? Because here you have a specialist, cornea and a dry eye specialist will be able to spend more time with every patient. It is a specialized field and it's a multidisciplinary approach. Now, supposing a patient with arthritis has dryness, we know how to work in conjunction with a rheumatologist or your orthopedic surgeon. We can adjust the medications and do what needs to be done. Customized treatment. As I explained, for a disease which has so many myriad of causes, you can't have one treatment. So we need to customize it depending on the type of dryness you have and what suits you best. And of course, advanced therapies. So everybody thinks that dryness is cured with drops, but that's not the case any longer. We have many advanced therapies in the form of light treatment, which not many people know about. So what these do is they deliver some sort of heat to your face and eyelids. And as a consequence of that, your tear production is better. I will touch upon that in my later slides. So what happens in a dry eye clinic? We will obviously start with artificial tear substitutes, lid massage, and many patients who have suffered will at some point use some of these lubricants. But for the management of dry eye, this is really, as you see here, this is just the first step. There is an entire step ladder treatment where we have a variety of options and treatments available. There are drops which you need beyond lubricants, and that will be best told to you by an eye specialist. We also have advanced diagnostics nowadays. We have cameras which actually check, if you see out here, this is a camera which is checking the inside of your eyelids, and these white lines that you see are your glands. So with a camera, we can actually tell you whether you have enough glands, you don't have enough glands, and then customize your treatment accordingly. And as I said, I'll just touch upon the light treatments. We have advanced treatment modalities where we deliver either put plates inside the eye to deliver the heat inside the eye, or we have it in form of masks where you will put a mask and you have light therapies given on your skin, on your eyelids to stimulate all the glands of your eye to make them produce tears better. So thank you. And you have any questions? I stop sharing.
You want to do the questions later, Vicky, together?
We'll ask together. Together.
Manoj, can you give me sharing rights, please?
Yeah, you already have it, Deepak. Go ahead.
Okay. Okay, mine is a little less technical. It's more about what we can do at home when we are sitting in front of the screen the whole day. This concern about sitting in front of the screen is obviously more amongst parents whose 5, 6, 7-year-old children are spending 3, 4 hours on a computer, and of course the older kids also. Of course, a lot of adults too who are working from home now only have the option of meeting somebody on the computer, and they are on the screen for 10, 12 hours a day, which is causing them problems. So obviously, because of the COVID, we are all at home. The schools have shifted to online. And what I will tell you today is what does using a computer mean, what you should know regarding what that can cause you, and what you can do at home to help with the situation. So there are 9 things that you can do. Now, computer is like doing any near work. Reading a book is also doing near work. Looking at your phone is also a near work. And what studies have shown is that the more near work a child does, a person younger than 15 years of age, the more near work the child does, the higher the chances that the child will develop a minus numbered glasses. He will get minus numbered glasses. It is also called as myopia. Okay. The second thing that both children and adults experience when we look at a screen for the whole day is, because we want to see the screen clearly, we are actually focusing a lot. And if you constantly focus a lot, it's like basically lifting a weight in your hand and holding it high up in the air for the whole day. And that will obviously cause us fatigue. It will cause us eye strain. And the third thing is, which Dr. Zelda mentioned, is when anybody looks at a screen, be it a child or an adult, we tend to stare at the screen. Our blink rate drastically reduces. Now, blinking helps in keeping the front surface of the eye wet. So if your blink rate reduces, we tend to get dryness and then associated symptoms. All right. So for parents, or for most of you who may be having grandchildren at home, your children may be worried for them. And one thing, people are asking me, Deepak, can you write a letter to school and say that you reduce the school time? Now, as an individual situation, once in a while you can do that. But if you look at it from the school's point of view, they can't really shut schooling. They have to keep schooling going on. So I don't think it's really easy for parents to just suddenly say that now we are not going to do online schooling, because something probably has to happen. You can't just not do any school. But what parents can focus on is to reduce the time that children spend on screen when they are not doing schooling. So a lot of children are watching YouTube videos or wasting time doing something else. That can be reduced. But the most important thing that people should know is that if children use the computer for 6 months or 8 months, a little more than what they earlier did, it's not really going to significantly harm their eyes. So the main message that I want to give is to not really worry about extra screen time. Okay. Now, what are the 9 things that you can do? The first is to take a break. So there is a rule. It's called the 20-20-20 rule. And the rule says that every 20 minutes, you look 20 feet away for 20 seconds. Okay. And what this does is that it basically, firstly, your staring stops. So second is you look far away. So all the muscles that were working to help you see the computer screen clearly are now not working anymore. There's a different set of muscles working. So the eye basically relaxes and your eye strain reduces. All the children, I think the schools are aware of this now, and they have reduced their class time to half an hour, and they're giving children a break every half an hour. The problem is when the children are getting a break, they are using that break to watch some other YouTube video on the same computer that they were sitting in and doing their online schooling. So children are not ready to get up and just look outside the window and take a break. So I think that we need to kind of tell our children. The second is, now if you see this child, she's probably just having fun on a hot day. The problem is that when wind blows across your face, the cornea dries up faster. So if your child, or if you, when you're working at home, are sitting on a computer with the AC draft on your face, then you should try and change your position. If you change your position, the dryness that happens in your eyes will decrease. The third thing that has been proven by studies, especially for children below 15 years of age, is that it is very, very important that they play outdoors for 1 hour a day. When children play outdoors, they actually look far away. And again, when they look far away, it helps them reverse the action of the muscles that were functioning when they were looking at a computer. This reduces the chances of children getting minus numbered glasses. Okay. The fourth is when children have finished their online schooling, and when they are, doing their own fun things on the phone or the tablet, then we should encourage our children to cast the content onto the television. There are little gadgets available these days which can help you mirror the image of the phone on the TV. A lot of people actually do Zoom calls also in a manner where they cast the content onto the TV. And this will help because then they're not looking very close up. They're looking a little far away, and this will help the children. As Dr. Zelda mentioned, there are multiple drops available in the market. I have just put up a picture here for the sake of putting up a picture, but actually this is only one brand. This is of course a well-known brand, but there are many, many drops that you can use. Now, many times, not only in India, but in the world, but world over, these drops are available over the counter. So you can actually go to a pharmacy and buy some lubricants and use these lubricants if you have just started to develop symptoms of dryness. Now, regarding this blinking rate, for adults, I think we should become a little more conscious of the blink rate and consciously blink when we are working on the computer. All right. For very young children, it's very difficult to keep telling them to keep blinking. So one way to deal with very young children is, if the mother or the father is sitting next to the child, you can actually just chat. If you talk to the child gets distracted. And if the child gets distracted, the child looks at you, the child looks somewhere else. And when the child moves away from looking at the screen, the child will actually blink a few times. For older children, I think parents should talk to them and make sure that they understand that they should keep blinking. I think for older children, especially when they play games also on the computer or on the TV, they tend to just forget to blink their eyes completely. The seventh is to maintain a posture. Now, this we know for multiple reasons, not only for eyes, but what a correct posture will do is it will reduce overall fatigue. And
I think you'll have to call him again.
they are very tiny, we tend to just like an adult would, so that
Deepak, your screen is frozen.
Can you hear me?
Deepak, we lost this part.
In between we lost you for a bit.
I'm sorry, I don't know what's wrong with my internet. I'm sorry about that. So I'll just repeat the point that I was on. The posture is important not only from an eye perspective, but also from an overall fatigue perspective. So the more incorrect posture that we're sitting in for a longer period of time, the more tired we will get. And therefore, it's important that we as adults also maintain a correct posture. For very young children also it's important, because they are very tiny. They tend to sit anywhere. They're sitting on a couch, they're sitting on a bean bag, and that is not a right thing to do. So that is something that parents should think about. Of course, we have to hydrate well. We tend to forget when we are at work or when we are on the computer, in meetings, after meetings, we forget to drink water. And one thing for adults is, if you have a big glass of water, you should try to drink 8 glasses of water in a day. Okay. That is something that you should keep in mind. And what we are noticing is, because the schedules have gone for a whack, everyone's sleeping schedules have also gotten disturbed. I think it's important to get 7 to 8 hours of sleep, even for adults. For kids, it could be longer. And what has happened, what we are seeing in my hospital is that when parents come in and I ask them this question, the children are sleeping very late. Can you hear me?
Yes, we can.
Sorry, the children are sleeping very late. What happens is, they have to anyway get up in the morning for their school. They don't get enough sleep. They get tired, and then upar se they're on the computer the whole day. It just adds up, and then they become cranky. They become irritable. So all these things will be avoided if they sleep early and they get enough sleep. So these are the 9 things that both adults and children can do at home to help with the increased screen time. To say that you reduce your screen time or to stop the screen time is not really the solution. The solution is to do the other things that will actually help you get on with it. One of the most common questions that we have been asked is about blue blocking glasses. So companies like there are a lot of online companies that are selling glasses, and these companies have obviously marketed very hard to sell these glasses, but these glasses actually add no value. Okay, so when my friends call up, I actually tell them that they are useless. Many of them still go ahead and buy the glasses, because I think these glasses work as a placebo for parents. Parents feel happy that they are doing something for their child and, taking care of their eyes, but actually they don't do anything for children. I think it's more important that they sleep early, that they drink enough water, they eat well, they sit correctly when they're on the computer, they blink more often. I think these things are more important than just wearing blue light blocking glasses and thinking that now all my child's eye problems are going to be solved, because that's not really going to happen. Okay, I think so. Those are the 9 things that I think we all can follow at home, and we would be happy to take any questions that anybody may have. Thank you.
Thank you, Deepak. That was fabulous and so simplistically put. It was so clearly understood by everybody here. And so we will ask you questions now. May I ask a question? This was asked by my son, Naren, who's sitting next to me. And this is a carrot good for the eyes. And, also they recommend early morning walk on green grass. That will help to reverse eye myopia.
Vicky, you forgot the barefoot part of it.
Yeah.
Barefooted.
Yeah. So I have heard that too. So first, coming to the carrots perspective, the carrots basically have vitamin A, and vitamin A is needed for one function in the retina. All right. But whenever you hear about any nutritional supplement, what traditionally we have been hearing, it is actually mainly for malnourished people. It is, we probably had a lot of that. We still do have some of that. But for our type of people, by giving carrots, we are not solving anything. Okay? Because our kids, more than undernourished, they're probably overnourished. So to feed them more stuff is not going to solve a problem. I think what we can overall in general focus on is the quality of food. Is it balanced? Is not too much sugar? Those kind of things we can focus on. I don't think we need to really focus specifically on carrots for the eyes. It's not going to do anything. Regarding walking barefoot,
Deepak, we lost you again.
But now when I am older, and I think we think that it was because when you step outside in the garden, you tend to look far away. I think that's the reason. If you look far away, you are reversing the action of looking at a computer. I don't know the other reason for it. I wouldn't say there's no reason. There may be a reason which I'm not aware of, but I just think if you look far away, you are reversing the action of looking at a computer. Yes, madam.
I think the green color is supposed to be soothing for the eyes. And that's why, if you remember, the surgeons always wore green initially. Now everybody's on blue. So yeah, I think that's one of the reasons.
Maybe. Yeah.
Deepak, I have a question for you.
Go ahead, sir.
Is it advisable to have a soft backlight when you're viewing either the TV or the com? Does it make sense to have a small, especially in the evening, not in the daytime, to have a soft backlight? Is it more easy on the eyes, or is just
okay? More than a soft backlight at the back, what is important is to reduce the brightness of the screen to an extent where you can comfortably see the screen.
Right. Okay.
So we don't have to dim the light so much that we ourselves start having a challenge looking at the screen comfortably, but it doesn't have to be at max brightness also. And I think that is probably more useful than thinking of a backlight for the computer when you're sitting in a particular room.
Okay, because most generally are adjusted to for the day and the night. I mean, the latest laptops and all automatically sort of provide.
Correct.
Okay. Thanks.
In fact, all our phones. Sorry, sir. Go ahead, Mr. Sharma.
You have a question?
May I ask? Anil Ambo. May I ask?
Yes, sir. Go ahead.
Anil, go ahead. Anil, please.
Deepak, I remember my granny used to make homemade kajal, from a diya lamp, I think mustard oil or something, and then the black kajal she used to put in eyes. She lived to a ripe old age of 80 plus, and she never wore specs. Any role of that kajal, or it was what? This is a homemade
Surma.
kajal, I remember.
Yeah.
Surma, yeah, but They used to light a lamp and then that black used to collect.
Yeah.
That was the kajal we used.
Yeah. So we actually, whenever I see a child with kajal in the eyes, I almost get irritated at the family these days. What happens is, firstly, at that time, I know it worked or whatever happened with that, but that kajal, it may not be clean, sir. It may be unsterile. And the infection will only increase if you leave it around for some time before applying it to the eye. Secondly, if it goes in the eye, it can again cause irritation, allergies, dryness, so if you have to use, if especially for children, though, it's a complete no using kajal, especially the kind that you're talking about. For adult ladies who want to use eyeliner, we actually recommend them to use very good quality products, not anything available in the market, because we see a lot of people coming in with allergies and they themselves tell us that, I used a new brand of eyeliner and now I have this problem. Or people share eyeliner. Sometimes some ladies at home share an eyeliner. That also should never be done. So yeah, I hope that answers your question.
Can I ask a question, Deepak?
Go ahead.
Yes, please.
Deepak, I have dry eye problem and I use a heating pad, something like this. Now the question is, after heating, do I need to the drops immediately or use the tears later on? Does it make a difference?
Zelda, why don't you answer that?
Sure. Yes, sir. So I would recommend you keep at least a half an hour gap between your heating pad and your drops, because we need to know if the heating pad is working or not. The heating will self-stimulate some of the oil to come out. So what you can do is either you can use the drops before using the heating pad, or at least wait for half an hour for the action to actually take place, for the blood vessels to help the tears to secrete and flow out of the eyes. It would also increase the oil production. That is the main concept of using the heating pads in the first place. So I would recommend either you use it first and then you use the heating pad, or wait for half an hour after the heating pad to add any lubricant on top of it.
I see. Okay, thank you.
Welcome.
Further questions? There's more questions on eye care.